Good morning, media friends and members of the public. Welcome to the 11 a.m. Press briefing on the fight against the pandemic. In a moment, Chief Executive and the other officials will speak on the home support supplies delivery service. Because of the epidemic, please practice social distancing and keep your mask on. Chief Executive, please. Good morning, media friends and members of the public. Today, I, together with the Secretary for Food and Health, Acting Secretary for Home Affairs, as well as the Secretary for INT, we will give you an update on how the government is providing home support for those under isolation and quarantine at home. I understand that members staying at home can have access to this media briefing and know more about our home support services. The home support service is not a new concept. At the beginning of the epidemic, that is in early 2020, we have had in place a scheme for providing home support. The recipients of the service was those who need to undergo a home quarantine after arriving at Hong Kong under 599C, that is people arriving from places outside Hong Kong. For those who were staying at home during quarantine, we have provided support for them. For those without a residence in Hong Kong, a place was provided for them to undergo quarantine. At the time, we provided holiday camps run by the LCSD for them to undergo quarantine. Now, with the outbreak of the fifth wave, we have a huge amount of confirmed patients as well as their close contacts, and also secondary close contacts. That is the household members of patients. They need to undergo isolation and quarantine. Because of the sheer number, during the fifth wave, we practiced public health assessments and made adjustments based on our own circumstances. And then we implemented the revised measures. One of the measures is the measure implemented on the 8th of February. For close contacts who were required to undergo quarantine, we had the Stay Home Safe plan. Under the scheme, close contacts and close contacts of close contacts were allowed to practice quarantine at home. That is 14 days for close contacts and 4 days for household members of close contacts. Subsequently, we have revised the criteria for fulfilling quarantine for close contacts at home. That is on the 26th of February. If the close contacts have had received 2 jabs and tested negative on the 6th and 7th day on a PCR test, they would be deemed as having fulfilled the quarantine and could return to normal life. That was the arrangements for close contacts undergoing quarantine at home. Now, for confirmed patients, from the public health perspective, as well as what we have learned from the past 4 waves, we require all positive patients to undergo isolation at hospitals or community isolation facilities. Still, because of the sheer number of cases, having assessed the risk as well as considering our specific circumstances, we have decided to implement a triage treatment. For those necessary or those appropriate patients, they would be arranged to go into community isolation facilities. For those with high risk or serious symptoms, they would be arranged to be admitted to hospitals as soon as possible. For mild symptoms or patients with no symptoms, under the triage system, they would be arranged to check into community isolation facilities. There are several factors behind the triage system. First, the health condition of the patients, including the age and other factors. Second, the living environments of the patient. Third, whether they are high risk, they are household members with a higher health risk, including whether household members require care at home. Under the triage system, the CHP would carry out an assessment on the patients, as well as considering the preference of the patient before arranging for them to check into community isolation facilities. I have to emphasize that for people undergoing isolation or quarantine at home, they are all subject to the isolation order or quarantine order issued under CAP 599. When the isolation order or the quarantine order is still active, they cannot leave home, with the exception that they have secured a negative RAT test on the 6th of 7th day. Then they would be deemed to have completed the order. Now, for those undergoing isolation or quarantine at home, we have more than 300,000 people. But that's towards the higher range of the estimation. Now, the quarantine or isolation order would last for 14 days. So officially, they would be the order would be deemed as having completed on the 14th day. However, since early February, we have implemented the arrangements to allow those completing the for those securing a negative test on the 6th and 7th day to leave home. So more people have in reality completed the order. Now, since the beginning of the 5th wave, we have been increasing our capacity to provide support for those undergoing isolation and quarantine at home. However, we are still catching up. There are several concrete measures we are taking to provide support to them. First, on the first contact, we would deliver a packet with supplies to them. Now we are enriching the contents of the pack. Now later on, the secretaries will talk more about that. And then we have the hotline. For those staying at home, they may have many inquiries, so we have a hotline to provide support service to them. And having accessed the request made by the patients on the phone call, we would deliver support to them to the doors, including food supplies. Third, health inquiries. For these close contacts and patients, they may need emotional support, health assessments, tele-consultation, or even an appointment at designated clinics under the HA for treatment. About the contents of the home support scheme, the other three officials will provide more details on it. Now, for RTHK Channel 32, that is a channel dedicated to the fight against the pandemic. It will continue disseminating information on support. Now, I would like to make use of the opportunity to thank all the people who are involved in providing home support in Hong Kong. First, I have to thank the central government to provide us with continuous support, including the anti-epidemic packets. Second, we have to thank the logistics teams for delivering the packets. Third, we have to thank the volunteers, district organizations, as well as property management companies. Fourth, medical institutions providing help to man the hotlines, including private and public doctors, as well as tele-consultation service providers, including the Chinese medicine team at the Chinese University, whom I have met with yesterday. And also, we have to thank the designated taxi drivers who are driving the patients. We have some 400 taxis involved in the service. And also, we have to thank the neighbors as well as the residents in the same building where the patients reside. they are showing support by delivering supplies to them. Lastly, we have to thank members of the public who are complying with the isolation and quarantine orders at home. Thank you for complying with the orders stringently so that we can win the fight as soon as possible. Now I will invite the three secretaries to speak to you about the pursuant to the order of how we support the patients at home. I would first invite the Secretary for INT to talk to you. The INT Bureau and the OGCIO are the first contacts.
Thank you, Chief Executive. Good morning, fellow citizens and friends of the media. Combating the virus is a top priority of the government. We will be doing everything we possibly can to get this done. Starting from the 21st of February, we have taken over the work of distributing the anti-epidemic kit. Together with the ICAC, we have been standing shoulder to shoulder to do the job. We have distributed the kits to 100,000 people, and we have also distributed to 200,000 confirmed patients. The OGO is distributing the kits to the confirmed patients as well as the close contacts. The kits will be distributed to the door of the confirmed patients. Now, in the kits, we have the face masks, the RAT kits, thermometers, and also a handbook on COVID. We have also included the proprietary Chinese medicine and also wish the get well quick wishes. We're grateful to all parties concerned for their support. In particular, we're grateful to the mainland for making available these supplies. Towards the end of February, we have seen a surge of cases. The sheer number of cases means that there may have been some time lag. I hope that people who haven't received the kits would understand the situation. We will be identifying more teams, in particular the logistics companies, to join us. We have increased our capacity recently. Between 28th of February and the 2nd of March, each day we have distributed 10,000 kits per day, starting from the 9th of March. On average, each day we manage 50 to 60,000 per day. These tasks rely very much on ICAC and the OGO. They have deployed an enormous amount of manpower. We have 200 current and retired officers and 300 people from the tourism sector. The 6 logistics contractors have deployed well over 1,000 people to this task. I'm grateful to everybody who has taken part in the distribution work. We will be going full steam ahead to assist all the confinees. Jack. Thank you very much, Chief Executive, friends of the media. The HAB, HAD, and the LCSD are on the front line battling COVID. 14,000 staff members have taken part in various kinds of work at different times. Under the HAD, one of the most important tasks is to help the home confinees and give them every assistance they need. We're helping tens of thousands of people who are confined at home. We are making available the necessary assistance. The first issue is the hotline. Beginning from the early last month, we have designated hotline 1-833-019, 1-833-019. We have increased the lines by threefold, from 100 to 280. The hotline centers we also have increased to 3. We have 540 colleagues from the department to man hotlines around the clock in 3 shifts. We handle more than 10,000 cases. Yesterday, the number stood at 11,700. The hotlines provide one-stop information service. We address all manner of questions. When necessary, we can make referral to other departments for follow-up. Like for medical issues, we will refer them to the DH and the HA for follow-up. For welfare issues, we will make referral to the social welfare department for follow-up. Because of the upsurge in the number of people who need help and the demand for hotline service, the HAD has further plans to increase more hotlines. Like we're going to set up the fourth hotline center and increase our capacity. We can manage 550 lines at any one time, or five-fold increase. In order for the SWD to deploy more manpower to handle the needs arising from the elderly care homes, we will be taking over the task to distribute the anti-epidemic kits to the care homes. Now, there are two advantages. One, we can handle the demand arising from the elderly care homes without having to go through the SWD. This will improve the efficiency and so on. And also the SWD will be able to free up more manpower to handle the issues relating to the care homes for the elderly. The HAD is going to be under tremendous workload. We will be deploying all the manpower available, including the volunteers and internal redeployment, to make sure that the task is going to be done well. Starting from yesterday, the HAD has covered Wotaisin, Yaochun Mong, Kowloon City, and the Southern District. We have covered these four districts and make available our daily necessities for the confinees. I hasten to add, though, that the services will be reserved to those who are deserving, who are really in need. That the home confinees should seek assistance also from their relatives and friends to meet their needs for daily necessities. Another task of the HAD is to mobilize local organizations and mobilize volunteers to distribute the anti-epidemic kits, including the supplies made available from the mainland. Like the IAT kits, the district offices have distributed 3.3 million boxes. The volunteers have distributed 370,000. Altogether, we have distributed 7 million or so boxes of these. We will be deploying the volunteers to make available the supplies to the senior citizens, those in subdivided units, the grassroots people, and the ethnic minorities. To combat this virus, the HAD is playing an important role. We are mobilizing the community organizations and Klansmen Association, and they are making a lot of contribution, and we're coming together to triumph over this virus. Thank you.
Now, Secretary for Food and Health, please. Thank you, Chief Executive. Good morning, media friends and members of the public. To effectively protect patients in the community as well as their household members, as well as to provide them with comprehensive health support to reduce severe and death cases as well as infection, it is very important to provide them with support. As a result, the government has been ramping up support in the community, especially for elderly people, to reduce the possibility of severe complications or admission. On the 7th of March, we have rolled out the online registration platform for those tested positive through RAT. Testing results as well as symptoms and information of household members can be provided online. The system would inquire whether the patients or household members need to check into isolation or quarantine facilities because of house environment. Based on the living environment as well as the needs, including symptoms of our patients, priority groups would be arranged to check into isolation facilities. The system also enable patients to declare or report the test results to the CHP in order to get support and to get support as soon as possible. Now, the two secretaries have mentioned the supply kit. With the staunch support from the central government, in a very short time frame, Chinese proprietary medicine has been delivered to Hong Kong to help us against the fight. The Chinese proprietary medicine provides an additional option for patients to treat the disease. Starting tomorrow, that is 14th of March, we will include paracetamol. We will include antipyretics with paracetamol elements in the supply kits to alleviate the mild symptoms of patients and provide them with more protection. Besides medicine, starting tomorrow, the 14th of March, we will begin distributing pulse oximeter to households with infections. Household members can check their arithmetic as well as the blood oxygen level with the kit. Considering high-risk elderly people, we will invite respite centers, RCHEs, as well as designated clinics under the HA to distribute oximeter to elderly people. Besides medicine and medical equipment, the HA is also providing a range of supports. Now, we have been having more than 10,000 cases each day. So the HA is stepping up support in terms of designated clinics and hotlines to offer protection to them. First, on the 15th of February, the HA has set up a hotline, that is 1-833-6115, operating from 8 a.m. to 10 p.m. each day to offer medical consultation or medical advice to patients. There are 110 lines. As of the 11th of March, we have handled 25,000 inquiries, mostly about the arrangements for isolation and quarantine, the criteria for completing isolation, as well as home infection control. The HA plans to increase the number of hotlines to 200 within March to meet the rising needs. To implement multi-level treatment, the HA will identify high-risk groups in the community, including those above 70 and those under 5 years of age, as well as pregnant women, 28 weeks pregnant women, as well as immunocompromised patients, to offer them with a priority in terms of support and treatment. The patient support core of the HA would review the patient list to reach out to high-risk people as well as elderly people. They would ask about their health and provide advice and support. If necessary, teleconsultation will be provided by doctors. If there is the need, they would advise the patients to seek treatment at designated clinics. On designated clinics, the HA has increased the number of such clinics from 7 to 17. For high-risk patients and those who experience mild symptoms like coughing, fever, or and so on, they can secure treatment. The HA plans to commission another 6 designated clinics next week, increasing the number to 23. Medical staff working as the clinics would provide appropriate treatments based on the clinical conditions of the patients, including prescribing oral medicine to treat COVID-19 based on the guidelines, and also referral to hospitals and isolation facilities would be made. If the quota is used up, then medication will still be prescribed to alleviate the symptoms. The HA will pay attention to the demand as well as the operational needs to adjust its service to cope with the latest situation. And also we are extra care. We will provide extra care for elderly people. Now, the community elderly assessment team under the HA would step up its service to provide referral services as well as teleconsultation services to patients. Based on the clinical conditions, doctors would also prescribe oral medication to them. The scheme has already been put in place, and more serious patients would be arranged to admit to hospital. The HA is also preparing an isolation health monitoring system to provide an online platform to support patients. A link would be sent out via SMS, and patients can report serious symptoms via the link. The system will also offer advice and information to them. And there is also a function to report negative test results after testing positive. This is another way that we will provide efficient support to patients. We understand that there will be a lot of anxiety experienced by patients and household members. Please pay attention to your health condition, practice home hygiene, as well as avoid face-to-face contact and meals together. Then you will be able to drastically reduce the risk and cross-infection. Besides the support provided by the HA and the government, I would also like to thank different sectors of the society as well as the frontline healthcare workers. They have been working very hard, and also businesses and funds have contributed supplies. District organizations and universities as well as the private sectors are also involved and contribute in various ways. I believe that if we stand united and stay calm, then we will be able to rise above the dire situation. We have confidence that Hong Kong will win the fight and we can return to normal life. Now we will open the floor for questions. Now please raise your hands and ask questions, and please identify your media organization, and please use our microphone to ask the questions. Now, because of the number of reporters present, we will limit the questions to 2, and there will be no follow-up questions.
The one in white mask in the middle, please. HK01. My question is, the HA said that the liaison office was involved in the procurement of the ventilating fans, but subsequently it said there was no involvement of the liaison office. Does it speak to the chaotic situation in our anti-pandemic efforts? Also, Dr. Lo Chu Kwong said that it is difficult to find manpower to look after the elderly people in the holding centers. That from the mainland, there are going to be 120 when you need 1,000. Is it the case that the mainland teams don't really want to come to Hong Kong? How are you going to resolve this problem? Right. On the first question, as far as I know, the Hong Kong SL government is not involved in the procurement of the ventilating fans for the hospital authority. I'm not sure whether Professor Chen knows anything about it. It is entirely the work of the hospital authority. As to who they approached for help, we have no idea. I think that they made the clarifications yesterday. So you cannot say that this has anything to do with the coordination effort of the government. As to the medical supplies or medical equipment, if they do have any particular needs, they can go through the task force on ensuring medical supplies headed up by Mr. Edward Yao. We are only delighted to put the medical supplies and needed by the HA in the list that we put forward to the mainland, and through the mainland authorities, they can be made available to Hong Kong. But for this batch of equipment, it happened a lot earlier, so we're not sure about the details. Manpower problem doesn't happened today. As I said, and as Dr. Law said, the population is aging. Many elderly people need care, but many young people don't really want to carve out a career in this field. We have done a lot of training. We have, the retraining board has also done the retraining work, but we're still running short of manpower. So in the care homes, we still need to bring in labor under the supplementary labor scheme, and there was a lot of debate over this. The Labour Advisory Board has been very strict with regard to the importation of labor, but this is an exceptional circumstance, and there is a relaxation regarding the importation of labor for the care homes. I'm sure that the Labour Department has been very swift in approving a few dozen applications for the care homes. Now, the SWD has to run these holding centers for the elderly, and they are recruiting about 1,000 people from the mainland for us to be able to start these holding centers for the elderly that are accommodated in the indoor games centers. According to Dr. Law, about 100 or so have already come along, and they have been swung into action, but the problem doesn't really lie in the remuneration. Here, together with all the allowance for the anti-epidemic work, the pay is close to $30,000. Now, for Hong Kong carers, they are recruited on similar remuneration. I think it is only human nature, given the COVID situation in Hong Kong, people might be put off. People who otherwise might be willing to come to Hong Kong might take a wait-and-see attitude. But we will be rising to the occasion. We have mounted widespread publicity in Hong Kong, and the number of people who are willing to take part has increased. So the SWD, the Labour Department, and also the LWB, all of them have been trying very hard to recruit enough manpower to look after the elderly population at this level. I'm not sure whether Professor Chan has got anything to add. Mr. Sid is also aware of this. Right, let me say a few words here first. I hope you would appreciate that the HA is making urgent procurement of the ventilation fans for the purposes of air change facilities. And within a short space of time, they have to procure all these ventilating fans to retrofit the wards for them to take on the COVID patients. That this is really a warlike situation, and this is an urgent business. We are not involved in the procurement, but I hope you will understand that under these circumstances, we have to make exceptional arrangements to make sure that these supplies and equipment would become available to safeguard the public health and public life. Well, like the Chief Executive and Professor Chen said, the whole procurement was undertaken by the HA. The whole process was pretty urgent. Last weekend, I liaised with various IT companies, and the HA also approached me as well. The problem is in the course of delivery, there was some disruption. So in the process, I was involved in assisting the HA to identify some people from the shipping industry. I must emphasize that during this COVID battle, we have to be pulling in the same direction. This is a case of all hands on the deck, and if any party is facing any particular difficulties, we will be giving every assistance, and I hope that we will be achieving the same goal here in Hong Kong.
Next question. The gentleman in the front. Good morning, Chief Executive and Secretaries. I'm from CCTV. Now, recently, what new measures have the government implemented to more precisely tackle the epidemic? Now, compared with the previous measures, what are the changes and what is the effect? Now, the daily new cases number has stabilized. So, what bottleneck are we facing? And should the government not coordinate efforts from different sectors to fight the epidemic? In terms of mobilizing the community's efforts, I would invite Mr. Jack Chan to talk about it. The Home Affairs Bureau is taking the lead on this front to involve the community in fighting against the epidemic. The fifth wave is very serious. We have a huge number of close contacts and patients. We have to continuously adjust our measures. The first criteria is we have to be precise. We have limited resources and limited manpower. That's why we have to be very precise. Like Professor Liang Wanian said yesterday, we have to be very, very accurate. We have to be very focused and precise on all fronts so as to better address the problems we have. One of the landmark measures is triage and multi-level treatments. We cannot apply the same arrangements and processes to each and every case. So we have to triage the patients. Like we have done in the fourth wave, we were very specific about each case. We had to isolate each patient at home, and all close contacts and secondary close contacts were put in quarantine facilities. Now we cannot afford to do that, so we have to be precise. For those who really need to be isolated at home, they would be arranged to go into community isolation facilities at once to avoid cross-infection with household members and the community. Another precise measure is sending elderly residents in care homes to appropriate facilities so that other healthy residents in the homes will not be infected. So that is just an example. In terms of multi-layer support, we are also very precise. We have limited treatment facilities. We must provide multi-layer treatments to different patients. We have 5 layers. For the first and secondary levels, they would be treated at hospitals with secondary and primary isolation beds. For critical patients, they will be treated at ICUs. For people or patients as the third layer, they are more stable. They will be housed at community treatment facilities, including the AWE community treatment facilities run by the HA, as well as the North Lantau Hong Kong Infection Control Center, which was built with the help of the central government. Now, we also have the fourth layer, that is treatments and respite services targeting elderly people run by the SWD. Elderly people who are infected cannot be sent back to care homes, so we need a respite or temporary care center to provide care as well as monitoring. If we do not provide care to mild cases, they may become severe. So that's according to what Professor Liang said. We have to prevent that. So we are stepping up manpower to provide more respite services for the fourth layer. Now, the final layer or the final level is staying at home. Well, it is not that we do not provide support to people staying at home. That's why today we are here to explain how we are supporting those isolating or quarantining at home. Now, Jack, please talk about community involvement. Thank you, Chief Executive, as well as I also thank the reporter from CCTV for asking this question. This is a very important question. We have to mobilize all sectors to join hands with the government to fight against the epidemic. So with the leadership of the Chief Executive, the HAB, me and my team are doing exactly that every day. That is our utmost priority in terms of mobilizing and encouraging the community efforts. There are three aspects. First, human resources, and then resources as well as morale. Now, in terms of manpower, we are mobilizing our volunteer teams. The number is very high. Now, the community alliance has some 6,000 volunteers providing help every day. The volunteers union has mobilized 4,000 volunteers. The HAB is also recruiting volunteers from uniform services, religious sectors, and other sectors. We have recruited some 11,600 people. It is a number at the same level of a major governmental department. They are delivering supplies, providing care to elderly people and ethnic minorities. Now, the second layer or aspect is resources. We have collected a lot of resources from the community, including masks, RAT kits, Chinese proprietary medicine, and so on. District volunteers would deliver these supplies to the persons in need. Third, morale. With the help of our friends, we are creating a positive atmosphere to fight against the epidemic. Thank you. Now, the other question is about the stabilizing number or the plateauing number. So what is the bottleneck? So I hope the plateau would see a downward trend soon. Like I said yesterday, in the fight against the epidemic, we are in no lack of money. We are willing to mobilize more financial resources to fight against the epidemic. The Financial Secretary has set aside a huge sum of money in the coming budget. If we have a shortage of money, we believe that the Legislative Council, which is full of patriots, will help us. And also, with the central government's help, resources is not a problem. In terms of hardware, with the help from the central government, as well as the help from the property developers, as well as the public services, public works departments, we are achieving a lot of results. Now, do we have bottlenecks in terms of the law? Well, we have the emergency regulation ordinance. Now we are removing the red tapes, and we are speeding things up. In terms of steering and command, command, we always have steering and command. Like Mr. Chen said, previously, the food supplies and supports provided by the SWD have subsumed under the HAB. That is how we are coordinating efforts. Now, the final aspect is manpower. We cannot so-called borrow manpower. Of course, we are borrowing manpower in a sense. We have a lot of help from the central government. They are delivering a lot of MIC components to us. However, we have a huge shortage in terms of medical treatment and support. We are going to ramp up the capacity as soon as possible. Next question, the lady in the front. Hi, I'm from Cable News. Now, for patients who have received 2 jabs, if they are after infection, they don't need the booster jab. If they are tested positive via RAT, can they use the isolation order to be approved to be exempted from the 3rd jab? Now, the government is accepting RAT positive results. However, there are lots of different brands in the market, and they have various results. Why is there no regulation? RAT is a kind of medical appliance. Now, in terms of regulation, the government has been talking it for 20 years and still we don't have it. Are you going to give it up? Now, are you exempting registration for trucks delivering medical supplies to Hong Kong? And what is the legal basis? How many trucks are exempted? Now, police would escort the trucks, but what about the third-party insurance? Sorry, that's about it.
Let me address the third question first, and I defer to my colleague to address the other questions. In this anti-pandemic effort, it is a tantamount to a war, and in a war-like situation, we have to make things happen quick, and we sometimes would need to deal with the situation not in the usual way. Now, we have invoked the ERO to implement the exemption. Now, since we have to take swift action in this battle against COVID, we cannot really be constrained by the existing Hong Kong legislation, so we are offering exemption to override the provisions. And the exemption power has been conferred upon the CS, and there are certain requirements. It's only when these requirements are fulfilled, the exemption will be granted, and every single case would go through the CS. Now, your case probably is in this category. I'm not sure how many of these mainland trucks that have been exempted for the closed-loop operation. Now, you may ask, what are they coming here for? That they're coming here for the people of Hong Kong. They are delivering the fresh food and also the anti-epidemic supplies to Hong Kong. So it is for the purposes of facilitating this kind of work that we don't really want the existing provisions to impede us, because battling the COVID is the overriding task. Right, about the third jab. The CHP has the Joint Scientific Committee, and on a regular or irregular basis, they would look at the current development and also the vaccination program for different people. They would have regard to the latest scientific data when making the recommendations. Also, the other thing is the operational side of the equation. We understand that the scientific committee is of the view that some people don't really need the third shot. If people have this message disseminated, they don't really have to go for the third jab. And in our computerized system and in the whole process, we would flag up these cases. I don't have the information with me for the time being, but as soon as we have the latest information, we will post this on the web. The other question is about the RAT kits. On our website, we have listed all the rapid antigen test kits that the government is of the view that they are effective. We all understand that in the community out there, there are all manner of rapid antigen tests. I hope that people would pay attention to our website. If there are doubts on the part of the members of the public, they are welcome to go for a PCR test to verify their own status. We also have a mechanism whereby people using the RAT to self-test, that we would conduct spot check as well. Let's make the last question. The lady in the red mask, please.
3 questions from the South China
perhaps
Morning.
2 questions only.
Okay. From the South China Morning Post, you just said that 300 1,000 people are now under home quarantine. Do you have an estimate of the number of people who have not received any support or supply kits yet? And the second question, the mainland China is struggling to contain its perhaps the biggest COVID outbreak since the pandemic erupted in Wuhan. How would it impact the anti-epidemic work in Hong Kong? And mainland officials have been urging Hong Kong to strengthen its interdepartmental coordination. Do you agree that Hong Kong needs such a mainland-style joint mechanism like Lun Hong, Lun Fong, Lun Hong in Hong Kong? Thanks.
About the number of people under home quarantine or home isolation, the figure of 300,000 or over 300,000 was derived from a combination of two figures. One is, of course, those who have been issued home quarantine. In other words, they are not positive cases. They are the close contacts of an infected patient, where in the past they were also asked to go into a quarantine facility. But from the 8th of February, the Center for Health Protection has adjusted its policy because of the large quantities of people. So these people have been undergoing home quarantine. I think the figure is about 150,000. But as I explained, this figure is likely to be an exaggerated figure because it was calculated on the basis of a 14-day quarantine period. But actually, from late February, the Center for Health Protection has already adjusted its discharge policy to the extent that if a person under home quarantine or home isolation who have taken two doses, and obtained a negative RAT test successively for day 6 and day 7, then they will be regarded as a discharge case. So comparing the day 6, day 7 with a 14-day, then perhaps there will be a certain number of people who actually are no longer under home quarantine, despite a home quarantine order of a 14-day duration. Then the other half will be those infected cases under home isolation. But this figure is yet to be very carefully assessed, because in the very early stage, you'll remember that because of large numbers, we may not be able to issue an isolation order to every person under isolation, and many of them have actually recovered. I don't have a figure on the number of people amongst this huge population that has not received our support. But I would confess that because of the large numbers of people who need or who are in that situation, we might not be able to reach out to everyone. This is just because of a limitation in the capacity. Although we have been trying very, very hard to make sure that we could provide some service. For example, in the service under the Secretary for Innovation and Technology, which is the first point of contact. Once we, or OGIO, once they get the list of names of infected persons, they will arrange their logistics company to send this bag, this anti-epidemic bag with all those things within it to each and every of the infected person and their household members. Okay. At the beginning, it would be very difficult to catch up. But I think a few days ago, they managed to catch up by distributing 60,000 bags in a day. Yes, but of course, if today's volume, again, is a very big volume, then I cannot guarantee that we'll be able to do it within the 24 hours that we want to do. But we will certainly try very hard through all the things that you have heard this morning about more designated clinics and more volunteers and more hotlines in order to serve this population of people who need to stay at home. I sent my best wishes to mainland compatriots because they are now facing with clusters of new cases emerging in various provinces and cities. I have every confidence that the Central People's Government, which has so successfully combated the COVID-19 epidemic for the last 2 years were able to rise to the challenge and also suppress this wave. At the moment, it has no impact whatsoever on Hong Kong's anti-epidemic work. It also has no impact whatsoever on the supply of materials and assistance to Hong Kong. The only impact, I suppose, is Professor Liang Wannian has gone back to Beijing instead of continuing his stay with us. But he has given us a lot of good advice, and other members of the mainland expert group are still with us to give us advice to look at how we combat the epidemic. But Professor Lang has left 2 days ago, or yesterday. He has left yesterday. Other than that, I think we will continue to have the needed support from the central government. With a wave of this magnitude, of course, we could do better. We are doing better every day, and we are not complacent. We will try to improve every aspect of our anti-epidemic work. But I would say that if people ask me whether we have a mechanism to join up the government to fight the epidemic, we have. We have it from day one. And that mechanism is clearly laid down in internal guidelines and published after SARS at a 3-tier response level. And we have not suspended this highest emergency response level with a very strong interdepartmental mechanism for the last 2 years and 2 months. And that's why I could say that we have 121 meetings held, and every day I am in command of this interdepartmental effort in order to join up every aspect of the government establishment to fight this epidemic. And I appeal to the people of Hong Kong to continue to support us and to comply with the various anti-epidemic measures as applied to you as a citizen of Hong Kong. And together, we'll be able to come out of this fifth wave of the COVID-19 epidemic. 最後預告下，聽日
Finally, an advance notice for tomorrow's meeting. Tomorrow we will focus on how we provide treatments to COVID patients in 2 aspects. Now, the Queen Elizabeth Hospital will complete the procedures of receiving referrals of COVID patients by tomorrow. So tomorrow we will update you on the treatment conditions after the conversion of certain hospitals. And reporters and electrical members want to know more about the 2 new oral medications. So tomorrow we'll talk about the procurements and prescription. Experts will tell you the effects, the efficacy of the medication. So tomorrow I will appear together with the Secretary for Food and Health and the Chief Executive of the Hospital Authority and 2 professors to give you more updates. Thank you. This is the end of the media briefing today. Thank you very much.